So let's talk about posterior open bites and clear aligners. This is a super common problem, okay, that I get a lot of questions about, so let's dissect it here, okay? So what happens when you're going through clear aligner treatment, patients sometimes develop these posterior open bites, and a lot of doctors think it's coming from the issue with the posterior or the back teeth. But actually, it's coming more from premature anterior contacts, okay, and lack of overjet. So it's the number one thing that you should kind of investigate, because it's not coming, the problem is not coming from the posterior teeth, it's coming from an anterior problem, okay? So what are the things that you should check for? Okay, so number one, you should check, make sure the patient doesn't have an anterior slide and they're not sliding forward and they actually do have a posterior open bite, okay? Some patients simply posture forward. For example, if they wear a sleep apnea appliance, which should be another thing that you check. If they wear a sleep apnea appliance, they can easily posture forward. They can have some condylar growth, so now they're not going back to centric relation, okay? So that would be the number three things that you check. Make sure, check patients in CR, make sure that they're, and in CR, you know, they still have that posterior open bite, okay? Which will be the case in most of the cases. So you put the patient in CR, they have a posterior open bite. Now what do we do? Well, you should check, make sure the patient has enough overjet, okay? Because this posterior open bite is almost always coming from premature anterior contacts and deep bite, okay? What happens is you start a case with no overjet, and as you procline the lower teeth, because you might align the crowding, the lower teeth procline and then they hit on the lingual surface of the upper teeth, and now the patients cannot bite together, the posterior teeth cannot come together because of those premature contacts on the anterior teeth, okay? So that's also a problem when a patient has a deep curve of SP, okay? When they have a deep curve of SP, lower anterior teeth are kind of super erupted, and that kind of makes the premature contacts on the anterior teeth even worse, okay? So these are the biggest things you should consider, and I promise that your posterior open bite cases will go away and you'll be able to fix them, okay? So how do we fix them? Because most posterior open bite cases come from premature anterior contacts and lack of overjet. You need to create an overjet, and the best way to create overjet is procline the upper teeth just a little bit, as long as you can, and retrocline the lower and procline the upper teeth as well as retrocline the lower teeth. And you can do that with IPR, for example, as well as trays. And then you need to also correct the deep bite, and you can do that with intrusion attachments, okay? So as you procline the uppers, retrocline the lowers, and you do some intrusion, lower anterior intrusion, the open bite, the posterior open bite is going to go away, because you will have nice leveled arches, so the bite will be able to come together, okay? So hopefully that answers your questions, and I promise if you do those steps, you will be able to eliminate and prevent your posterior open bite cases with clear aligners, okay? Have a good day. Bye.